You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, minimally invasive or non-invasive facial rejuvenation, how to look years younger without surgery. With us, we have Philadelphia's go-to facial plastic surgeon. We've had him on the program before. His results, and I'm not trying to endorse him, but his results speak for themselves. Great natural looking results. We wanted him to come on today to talk about new technology and what could be done. So with us we have Dr. Timothy Greco. Dr. Greco, welcome to the program.
It's great to be here, Randy.
All right, now, you brought photos.
Yes.
When I think of facial fillers, I think of just right here, right? But you kind of open that way up.
I'll tell you what, most common place for filler to be placed in the face is the nasolabial fold. And you and I were talking about this in the green room earlier. You know, a lot of injections until probably the last 4 or 5 years have been centered here, okay? And what's happening is the lateral face has gotten neglected.
So we're talking about fillers. That means most of the fillers were placed just in the mid-face, middle part of the face.
Exactly. So that would be your nasolabial fold, you know, be your marionettes and things of that nature, lips, you know. But what's happened is that in the last several years, and most of this has been due through studies of cadaver sections, understanding the different layers of the aging face, okay? This is where we've come up with the concept that we don't only want to add volume to the central portion of the face, we want to add volume to the lateral aspect of the face and include it as a continuum, if you will. So let me show you a perfect example.
Okay, and we should mention, you teach other plastic surgeons, other health practitioners how to do fillers, right?
I can't begin to tell you.
But I mean, this is what you lecture on. Also, you are one of the busiest top, especially in Philadelphia, injector in the state.
Yes.
Is that true?
Yeah.
So you do a lot of these.
A lot of this, and it's just me. Unfortunately, I don't have staff. I'm in the process of hopefully getting some other people in to help me out a little bit.
No, we should mention. Before we start, I'm looking at your photos, and I'm so impressed. I'm saying, I need you to do a little bit under my eyes. So we called around some local plastic surgeons. They didn't have the right stuff for me, but it's good stuff. Anyway, so back to you, and people need to know. Look,
I'll make it up to you.
This is a real interview.
I'll make it up to you.
I'm not trying to endorse you, right? But after 18 years of looking at photos, these are some of the best I've seen. I mean, these are really good.
Thank you.
And I think you open my eyes, and hopefully when they see these photos, that it's more than just filling in deep lines.
Sure.
So anyway, I'll let you take it from here. So you brought some photos.
Yes. So this is a gentleman who is a physician who actually is very health oriented. He's a runner, and he has the conundrum of all athletes and all people that take care of themselves. Their body looks great, and their face looks emaciated.
So it's starting to get a skeletal-looking face?
Exactly. And, it's a shame because, it'd be nice if we can do something where the face can remain full and the body get tightened up. So if you look at this patient, usually what I do is when I'm looking at a face, I go from head to tail, okay? So what are some of the things that can give patient an aging look? First of all, a high forehead. Okay, when a patient has a very high forehead, their hairlines are receding, that's one of the issues. Okay. Number two, the temples. One of the things that has become incredibly popular now is injecting temples that are hollow.
So he has like skeletal temples?
Exactly.
All right.
And you can see it, right? Because you can see the lateral orbital rim right here in that picture. And you see how it's prominent it is?
All right.
Okay. And what that also is doing is that's causing his brow to drop, the tail of his brow to drop, okay? And I'll show you some pictures in the future on that. If you look at his eyes, particularly his upper eyelids, he's got that almost what we call the superior sulcus syndrome. And what that means is that the eyelid crease is located high. And what that does, it gives the patient that cadaveric look.
The skeletal look.
Skeletal look. Okay. The other thing is you can see that he has tear trough deformity. You can see the puffiness.
So underneath his eyes.
Sure. He's
just hollowed a little bit?
Exactly.
So from a lot of running and exercise.
Yes, and truly the reason for the hollowness under the eyes, as you see in this patient right here, Andy, is due to the fact that there were tissues that were more superiorly located, and they were covering the orbital bone at one time.
And they dropped.
And what happened is these tissues descended. And then this is one of the things that occurs. These ligaments become more visible, and this is what causes it. Take a look at his cheeks, okay? Look at, particularly in this region.
All right.
He's really hollowed out, and it's given him this second fold here. And it's a difficult thing to take care of. This is a gentleman that really, I think, that if you can fill him laterally and take care of his eyes, you can really make him look fresher and rested and just healthier, okay? So here he is afterwards.
Oh, wow.
All right, let me show you a 3/4 view. There's a 3/4 view before, there's one after, all right? Now, this one I think is the greatest telltale sign. Take a look at the before and after here. Look at the set of eyes to the left, the high lid sulcus, kind of
a skeletal over eyes.
Exactly.
So you filled those on the after. I'm looking at you've injected something.
What I did was I injected right underneath the orbital rim here, and what that did is that dropped down that crease, so he doesn't have that skeletal look. Can you see it?
Yeah. And then under the eyes, what'd you do?
And filled the teardrops, or that hollowness underneath the eyes. So, Randy, I want you to take a look at the front view for me.
Okay.
And I want you to tell me, does this patient look more rested to you?
In the after, yes.
Okay. You know, I could have done a facelift on him. And you want to know something? Making that skin tighter might have actually been in his detriment, because it would have thinned his face that much more.
Now tell me this, because there's something I learned in the green room when I was trying, for selfish reasons, wanting you to do it on me. We're calling plastic surgeons for some Restylane or something like that. And you only like to use, because RNs, the plastic surgeons in this town are using the needle.
Yeah.
You like using a cannula.
Yes.
Why?
Yes.
Why is that so important?
Well, the results are better, Randy.
Okay.
To be honest with you, with the cannula. Not only that.
It sounds more invasive, though.
Yeah, it's safer, actually.
Okay.
You know, it's a safer way of introducing the product. To go back to your question, Randy, about the cannula, I will tell you, this result that you're seeing right here was probably 85% of the injection that was performed was done with a cannula.
So when we hear about adding or adding filler all around the face, because it seems like, because I also see overfilled people.
Yes.
This does not look overfilled.
Yes.
Like too much filler.
Yes.
I mean, do you see that?
Oh,
I want to ask you about that.
All the time.
Is that just technique? They don't have an eye for it, in your opinion?
You know who the best injectors in the world are, Randy? That person who can get a great result with the least amount of product.
Okay.
That is where the charm is. So this is another sweet patient of mine. She came in and she had this overall kind of cachectic look to the face, okay?
What does that mean?
So when I say cachectic, I mean you're seeing a lot of bone structure, and it feels like somebody has taken a relatively thin sheet of skin and has just laid it over. You know what I'm saying?
Okay, yeah.
You're not seeing that fullness. I mean, let's face it, when we look at a young child's face, what is it that makes us see that youth? It's that smooth, round cherub look, right?
Yeah.
Well, some patients, as we age and things of that nature, we lose that soft tissue carpet padding fullness.
So you don't want their skeleton to show, like on that before?
Well, it's okay. It's okay to highlight the important structures and have them show a little bit, but really what you want to do is you just want to have a nice, smooth face.
Let's take a look at that other shot.
So here's a
same woman.
3/4 bear before and then after.
Yeah, it's very nice.
Yeah.
Totally different.
But I think you see it on the front view better. You can see how the hollowness in the cheeks as well as the hollowness in the temples. She doesn't look different, Randy. She just looks rested. She looks like
I'd agree with that.
Take a look at this patient.
All right.
Look at her lower cheeks. See how sunken in they are? This is after using sculpture. Look how much better that looks.
Wow.
Now tell me which person looks healthier, more refreshed, more, just
much different. So you put fillers on her where? When I'm looking at this, what'd you do?
I did sculpture in here. I did some neuromodulator Botox in her glabella, and probably did a little bit of filler in her nasolabial folds. But you can see that how
it's a softer look.
It is.
Whereas before she might have looked a little harder.
That's where the fillers actually really come in. I'll tell you what minimally invasive procedures do.
Okay.
They do two things for
All right.
you, okay?
All right.
I think they prolong the time when someone may need to go with something more aggressive.
Like a facelift.
Right.
Okay.
Or when they've had something done aggressively, by maintaining with a little bit of fillers and a little bit of neuromodulators like Botox or Dysphoreseamin, you keep that fresh face looking fresh.
Nice.
Does that make sense?
Okay.
Yeah, so you use it on both ends of the spectrum with surgery in the middle. Younger patients, they're gonna try and avoid it, you know what I mean? And, let me tell you something that is really, really important to mention along with these results that I'm showing you is getting these patients on a really good skincare regimen.
Okay.
If their skincare regimen is good, they make these results look that much better. Take a look at this. Tear troughs are a big thing in my practice. That patient right there, Randy, I come in and I ask her, what's bothering you? My friends tell me I'm constantly tired. And I said, well, what do you think why do you think they're saying that? And she goes, well, I think it's because I got these dark circles underneath my eyes. And I'd say, I think you won a prize there. That's exactly what it is. So what do? We fill these hollowness up and look at the dramatic difference in that.
Very natural, very nice.
Another thing that can do too, Randy, it's really, which is really unique too. You may not see it as much on that, but I've seen it on other patients that I've done tear troughs on, is that as patients age, the laxity of their lower lid becomes greater. And what happens is the lower lid pulls down and they get what they call scleral show. And scleral show is the white show of the pupil, okay? So basically, this is your eyeball right here, and this is the pupil, and then this is your lower eyelid. If your lower eyelid's right up against the eye, it looks more youthful. When this starts to pull away and you start to see that white between the
So what's the answer?
margin thing,
a filler does it,
you
really?
can actually put a filler in there, Randy. What it does is not only does it fill out the hollowness, but it also lifts the eyelid and gives it a little bit more of a youthful position. So it's a pretty neat little trick.
Now, we haven't talked a lot about adding their own fat to their own face. So this could be done either way.
Absolutely.
Depending on how much downtime, depending on their anatomy.
Exactly.
Their goals.
The other thing is too, that I think it makes this really unique, Randy, is the fact that we can do a rehearsal for our patients.
What does that mean?
Person comes in and says, I'm thinking about getting fillers, but I'm a little bit nervous. So, fat's going to be a tougher problem.
Because it's more permanent.
Exactly.
So you start them out with the fillers.
Exactly.
They try it on, it looks good, then they come back for the fat, which is a longer lasting.
Exactly.
Interesting.
And
you do that a lot?
Yes, I do. I mean, I'll mention fat as one of the situations and scenarios with patients.
So you like this first?
Well, I like it first if the patient is a little bit nervous about things. I want to ease them into it.
Now, for people just tuning in, we're talking about facial fillers and what you need to know, but you teach this to other doctors across the country.
Yes.
Also, the manufacturers of these fillers, you're one of the top users in the US.
Yes.
So lots of experience.
Yes. I've been doing fillers or neuromodulators.
That's like Botox and things like that?
Since 1991, even before 8 years before it got FDA approval, because I worked on a project when I was in residency where we were given a grant from Allergan to figure out dosaging. So this is something I've done for a long time.
Now, we're 45 minutes from Newport Beach here in our San Diego newsroom. And I see a lot, that's why I didn't like this topic, even you coming in, because but I could see it does, I guess done right, you can't tell.
Yeah.
They just look rested.
Yeah.
But I see these built out faces. I'm calling it built out, but there's no wrinkles, but they're big faces.
Yes.
Whose idea is that? Is that the patient's, or in the hands of whoever did that filler doesn't get it?
I think...
Putting you on the spot here, what do you think?
I will tell you, I think both are culprits. I think the physician, like I said, as I mentioned earlier, if they know where to place the product and they can place it in a safe, effective place, they're going to get a great result. And the patient doesn't need to walk out looking like a balloon. They don't need that at all. I think patients sometimes, depending on their psyche, they tend, bigger is better, and more, if it looks good.
So you have to talk them down sometimes?
Absolutely. And the key is that in this is to explain to them what is, how you can make them look as fresh and rested as possible with the least amount of product. I mean, that to me is where the challenge is. If you can save your patient a few extra, dollars and give them a good result because you understand the anatomy, you understand the aging process, and more importantly, you understand your product as well as how to apply it to the face, this is it.
Okay, good.
All right, temples I told you about, right? Take a look at this patient here.
So this temple area is common now?
Very common.
Really?
Very
common.
So
here's
take a look at that patient right now. What do you notice about her eyebrows, particularly as
they go out? So the temples, I'm looking at her temples.
Yeah, it's disappearing, right?
Okay.
It's gone,
Say
right?
that.
All right, now look what happens when it's filled. Now she's got the tail of her eyebrow back. Do you see it?
Wow. So all you did was inject this area?
Do you see how you followed the brow out? You lost it, but then now on the after, now you see the tail of the brow going all the way out. Do you see it?
Yeah, yeah.
Okay, so what did that do? That gave the patient a more aesthetically pleasing brow, and not only that, but by volumizing the temple, it's also given a little bit of a lifting vector to the tail of the brow. So not only are you allowing that brow to show itself, but you're also allowing that brow to be in a better, more youthful looking position.
Nice.
This is a cadaveric look, you know what I mean? If someone's really
so as you get old, if you live long enough and stay healthy, you start losing
no question
fat here.
Yeah, there's a fat pad here called the.
Is that right?
Called the lateral temporal cheek neck fat pad. This fat pad, which extends, Randy, from here all along the face down to here, has been the most neglected fat pad since we started injecting. Now, what we're finding out is that's the fat pad we got to start going after to give people that more youthful look.
I'm smiling because I appreciate your enthusiasm.
Yeah,
I mean you like this. And what's good is you could deliver the photos to back it up.
But
nice.
that's the other thing I was telling you about, the reason why I get so much into this stuff, because really to understand our business, you have to understand the anatomy of the face. And
so a facial plastic surgeon,
ENT trained, so people always
gives you a big advantage then, is what you're saying. Because you could see through the face in a way, right? You could see through the face.
It's a place where it's just, that's where I live, you know what I mean? And I visit it every day, so to speak. I live it 24/7. Another hollow temples before. Look at the corners of the eyes here.
All right.
And take a look at it. Now take a look at this after.
Oh my goodness.
You see a difference?
Yeah. I mean, if I were to guess her age in the before and then guess her age in the after, she definitely looks younger.
And that's only showing you a spot, all right? Patient, I told you that, in the green room that, didn't want to have anything to do with lasers or structural fat grafting or anything. She goes, Dr. Greco, I am just so fearful. The only thing I want you to do for me is I want you to make me look fresher and rested, and I don't want to see the inside of an operating room, okay? So this is what she comes in as, okay?
All right.
And boy, did I want to put a laser to her, right? I almost got down on my hands and knees. And
she said no laser.
I almost proposed to her to use the laser, but this is what happened. Okay, I said, all right, so I'm going to give you some fillers. I'm going to give you a little bit of neuromodulators in there. We're going to calm things down.
When you say neuromodulator, are we talking about Botox?
Yes. Botox or any of the muscle relaxants.
So Botox Where in the mouth?
Well, you know, if you can look, I don't know if the corner of the mouth looks like it's going up a little bit. I'll put some right here, and there's a muscle here called the DAO, or depressor anguli.
So are the patients that are coming in where you're doing their temples and you're doing, and by the way, what other areas are we doing that we haven't even talked about that you're doing on the face as far as injections?
One of the areas that is my pride and joy are lips.
Lips.
I just, to me, I don't know if it's the Italian in me or what, it's, a beautiful pair of lips to me is just, it's God's creation. And there is nothing that makes me more angry than a person that gets overfilled and all you see are these two hot dogs.
Or the big lips.
Yeah.
I'm glad to hear you say that because, see, look, we're in California, and I think women think that
you
men... You
guys don't have any problem with that here, do you?
Well, I'm telling you, that, overdone anything does not look good.
It doesn't.
Over filler, big lips.
Doesn't.
Like you're the big lip person at the party. Everybody's going, look at her lips.
You're right. We talked about this too. It's a caricature. I mean, it's a caricature.
So you don't like that either?
It's like that, like you had the weak chin. When we talked about the weak chin, whenever anybody draws a picture of a cartoon character, if they're trying to show that the person's, wimpy or whatever, the chin is really drawn back. If they're trying to show someone as too voluptuous, their lips, I always have a saying with my patients. I tell them that, look, I'm going to give you a very nice pair of lips that are appropriate for your face. And I will tell you one thing, that when you walk into my office, the lips will not come in before the rest of you come in. Right? And so here's a woman that came in, younger woman, okay?
I mean, these are pretty nice lips. I mean, these are great lips.
They are nice lips, eh? But you know something? She's looking at me and saying, I really don't care what you think. I'm in here to get these lips bigger, and this is what I want.
Okay.
So
So when you look at lips like that they're already great, what's going on in your mind about how to make these even better?
Perfect way to answer your question, Randy, is what I said before. When I have a patient comes in like this that has good anatomy to begin with and actually has relatively good volume, what I'm thinking to myself is, let me look at these lips and let me study them and let me figure out where the least amount of volume gets the biggest pop. Okay?
All right.
So what I'm doing is I'm looking at her lips and I understand certain ratios, like the front lip, 40% should be the upper lip, 60% the lower lip around there. And certain things when it comes to tubercles being highlighted and things like that. So what I'm doing is when I'm taking a look at a pair of lips like that, I'm thinking to myself, least amount of product, biggest impact. Okay, so this is her, all right?
Yeah, very nice.
All right.
It's not too much.
That was one syringe. Now,
Is that good?
I try to do, most of my patients that I do are the patients that want their lips done tend to be 40s, 50s. They want one syringe. You know what I mean? My younger patients want 2 syringes, sometimes 3 syringes.
So this woman, this girl, I mean, it is definitely sexy to have more voluptuous lips.
So let me show you another lip here, okay? This person here.
And it doesn't cost more to go to a facial plastic surgeon for your lips, right?
No.
It's about the same. So you might as well go, okay.
No. So when you see this picture right here, she didn't like her lips because she didn't think she had lips.
All right.
Also, what she had was asymmetric. Now, that's her after result.
Oh, nice. So just a little difference. Now she could probably wear lipstick, things like that.
Absolutely. Absolutely. And that fits her face perfectly. All right, last thing. I told you about rehearsals. You know what I mean?
Okay.
When patients that, when you mention structural fat grafting, that, well, maybe if they get a filler.
Like try something first before something permanent.
Exactly. Because you got to remember, a lot of these fillers that we use, Randy, are hyaluronic acids. Hyaluronic acids can be dissolved with an enzyme known as hyaluronidase. So you can get rid of them pretty quickly. Okay?
Okay.
Now, what happens if I have a woman, a young girl, who really wanted to have her nose done, but just is scared as can be?
Of surgery.
Of surgery.
No surgery.
No surgery. Sure. So what I do is I do the liquid rhinoplasty.
Liquid rhinoplasty.
Liquid rhinoplasty. What I do is I figure out what kind of filler I want, and I figure out what I would do with this nose if I want to try and make it look better. Okay, so this is what she comes in as, looking, okay?
All right.
All right. And this is what happens. This is this is 20 minutes later after an injection.
This is interesting. So is it like some illusion you create?
Yeah, well.
Because the nose does not look the same.
Right, so what did I do? Here she's depressed. So what we did is we added filler here, up to here, okay? And her nasal tip was kind of down and also a little bit bulbous. So what I did was I added some filler here on the nasal tip to just give it a little bit of definition.
Interesting. So what do they got? Non-surgical rhinoplasty or nose job?
That'll last maybe 6 months, maybe 9 months, but once again, it gets the idea in the
And you could add
mind.
fat later for a more permanent result, or you like fillers for the nose?
No, well, I'll tell you what, if this patient wants to go for something more permanent, I want to do a rhinoplasty on him.
Okay.
You know what I mean? So I think fillers in the nose are okay for very, very limited indications.
Okay. We are completely out of time. Great stuff. They can go to your website. If somebody doesn't like their nose, they don't like their hollowed face, what do you say? Bite them in? Did they get to see you, or one of your RNs do this?
No. Any patient that comes into my practice sees me. Everybody sees me. So if I have a patient who comes in and they're looking tired, they feel like they can use a little bit of a pick-me-up, they're not quite ready to undergo something aggressive, I think fillers and Botox and products like that are great to introduce the patient, show them what their face can look like with volume, help them with their lines and wrinkles, and once again, I think a good skincare regimen is important for these
Okay, good. We haven't even mentioned lasers and things like that. You do it all there at your practice. I want to thank you for coming on the show.
Great. Always enjoy being with you, Randy.
Thanks. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.